So how can parents help their children model those healthy coping skills? Learning mindfulness, that's a great thing that you can do to help your child. Combat some negative thinking. We call them ants, automatic negative thoughts. Step on those ants for those kids. If they're having negative thoughts, show them evidence that what they're thinking is not true. Good sleep hygiene, that's so important. Exercise, encourage them to talk about their feelings. Make time for your kids to have fun, like having something to look forward to and having fun. That is so important. And it doesn't have to be expensive. Going to the park and running around and throwing a frisbee or playing on the swings, that's free and it's fun. Also create moments of quiet for them. That could be quiet with a book, turning off the TVs, taking away their screens, just having a moment of quiet. Get outside, and that's one of the grounding skills I teach clients is you got to put your feet in the dirt sometimes, ground yourself to the earth. And then also encouraging art and journaling. So there's a lot of protective factors. We kind of talk about risks. This puts your child at risk, but there's also a lot of protective factors. So allow me in the next few slides to fangirl all over Dr. Bruce Perry. And he said, resilience is all about our relationships, right? Children aren't born with resiliency. We as parents, we as caregivers, grandparents, loved ones of these children, those relationships keep our children resilient. What children need the most is those healthy connections. That is where children do their healing, is in those relationships. So it's really important to remember not only your child who was a victim, but your child who is a secondary survivor. If you can keep them connected to the schools, to their friends, to your family, to the safe adults in your life, to their grandparents, aunts, uncles, whoever, this is going to mitigate so much secondary trauma from them. Your history of connectedness is a greater predictor of mental health and physical health outcomes than your history of adversity.